Today we're going to talk about the assessments that I do to look at things outside of the pelvic floor for my clients who have pelvic pain, and especially those with cycling or any sort of pain with sitting. So yes, in the clinic I look at the pelvic floor, but often it's these other things that I'm going to show you today. So first thing I start with is looking at the spine and seeing how people's spine moves, because pretty much, especially for my cyclists or anyone who has pelvic pain, tailbone pain with sitting, it's not just about the pelvic floor muscles or the pelvis, but like how are things moving around it? How's the spine moving? How are the hips moving? And so what I start with is a standing test, just like a forward bend, to see how much movement they get in their spine. So I'm looking at a couple things. Number one, just how flexible are they? Can they touch the floor? Can they go all the way down? Or is this it? Or is this it? You know, and what I'm looking for also is, does every part of the spine move or just certain parts? So I'll show you slowly. And so I'm trying to move every segment of the spine. And for me, and for a lot of people, my lower spine doesn't move great, but it does. And then my hips start to bend, and that's where I get the bottom of the motion. And then when we come up, same thing. So one more time, we're going to try to start from the top of the neck and go down one vertebrae at a time down the back. So I'm bending from the head, the upper back, the lower back, and now my hips. And so something I find, a lot of times people will say like, oh, I feel it in my hamstrings. And actually they're bending a lot from the hips, but their lower spine doesn't move. So the hamstrings have to make up for it. So that's the first thing I look at, is forward bending. And then I also look at backwards bending. And so with this, again, like how flexible are you? But also like, do you bend throughout, or is it like a hinge point? And then I usually look from the back, but then I look at sideways. And again, how much are they bending? And is it equal to both sides? And then we'll also look at rotation, so keeping the feet planted and then turning. So that's my standing spinal assessment. That gives me some good information to start with. So after I do a standing spinal assessment, I will look on the mat. And so I like to look in quadruped on hands and knees. And what I like to look at is CatCow. And so again, is the spine moving equally throughout? Or is there one part of the spine that moves much more than the other part? You know, like, are they getting all their movement from up here and this is like, not moving? Or is it more equal? I hardly see anyone that moves here and not here, but could happen. So yeah, is everything bending and arching? Or is it more from one part of the spine rather than everything? So this is another good assessment. I also look at lower body flexibility, because that tells us a lot too. If the lower body is tight, then that will often cause pelvic pain, tightness. So one thing I look at is the butterfly stretch. So are the knees way up here, or are they way down here? Are they symmetrical? For me, this one's a little bit tighter than this one. My knee's a little higher. Yeah, so that's a big one. I look at hamstring stretching. So you can look at it in this position. So can they even get into this position? Can they lean forward with their back straight? But I actually prefer to look at hamstring stretching this way. So this leg can be bent or straight, doesn't matter too much, but can they get way up here, or are they like feeling stretching way down here? Like where do they start to feel stretching? And then also this cross-legged stretch. So do they feel pinching in the hips, or do they feel stretching in the back of in the glutes? Is this position stretching, or can they bring this up? So all these things tell me about tightness in the leg muscles that might be affecting the pelvic floor. So then when I assess the hips, that's another part of the assessment, I'll have people lay down on their stomach, and what I'm looking at is the side to side motion. So oftentimes people go really well this way and like nothing this way. And so is there mobility in both directions? And then also, are they similar from one leg to the other? So looking at symmetry, looking at overall motion, and then a lot of people, they'll be like a hard stop out here. So it'll be like, oh, I could go forever, and then hard stop. And then also another thing I look for is like, are they moving their hips? Like, are they moving everything? Or is it just coming from that leg? So is it just this, or is it this? Are they getting pure motion, or it's compensated motion? I don't really care what the foot is doing too much. Another assessment I like to do is the hip mobility motion in sitting. And so what I'm looking at is the ability to rotate the hips. And so a couple things, like, do both legs have similar amounts of mobility, or is one tighter than the other? And so for this, I want the feet to be like hanging, and I want the thigh to stay on the seat, and just the lower leg. So I actually have like quite a bit of amount of mobility, but a lot of people like can't go out here. Like they can go in here for days, but this way is nothing, or it's like a hard stop. And so these muscles are deep, deep, deep in the glutes, and they connect to the pelvic floor. So this is another important motion and muscle and mobility to look at, especially with pain with sitting or pain with cycling. If you want to know what to do about what we found in this video, then watch the next video on the treatment portion. And don't forget to like and subscribe.